Good morning, everyone. My name is Araya, and I'm with the Kent Chamber of Commerce. Today, we are going to go over Medicare basics, and our speaker today is going to be Jeffrey Johnson from JBJ Insurance Group. This webinar is going to be recorded for future use, so if you do need access to that in the future, go ahead and shoot us an email or give us a call at 253-854-1770, and I will go ahead and let Jeff start the presentation.
Well, good morning. You're here because you'd like to know more about Medicare. I bet you've probably seen advertisements on television or in your magazines or in the mail, especially if you're anywhere between age 62 and older. So Medicare can be confusing, so I like to start out with this slide is I'll be your guide through the Medicare system. And just to let you know, I've been doing this for almost 40 years. Way back in 1981, I started as a health insurance agent after teaching for 4 years in the Shoreline School District as a science teacher. 10 years ago, I started my own company providing education and brokerage services for Medicare and individual health insurance. So it doesn't matter what your age is. If you're not covered by a group insurance plan, I can provide guidance for you. There's no cost for my services. It doesn't add anything to the price if you go directly to the insurance company or use an experienced broker like myself. Let's get started here. So a couple things to be aware of is you can actually have many different dates to start Medicare, but the first time most people are eligible for Medicare is when they turn 65, which is different than being eligible for maximum Social Security benefits without a reduction. So as you know, or hopefully know, most people today will get their full Social Security benefits sometime between age 66 and 67. And the next slide will cover that. Actually, I guess I skipped that slide. But the point is that a lot of people will go on Medicare at 65, but defer their Social Security benefit to age 70, so that it keeps growing 8% every year for waiting each year. A lot of baby boomers are turning 65, and I moved from being a group insurance broker to helping people on Medicare at the very beginning of the baby boom generation that turned 65, starting in the year 2010. And so I will probably never run out of baby boomers to talk about in my career. I expect to be continuing working here for 10 more years at a minimum, so I can help all the baby boomers as they turn 65. And boomers, as you know, kind of changed a lot of the landscape. More libraries were built, more elementary schools were built, and now more assisted living centers and nursing homes are being built because of the baby boomers. But let's just talk about Medicare. This is the big idea of where we're going in today's presentation. Original Medicare is at the very start, or at the very top. You have to be in Medicare A and B before you can decide if you want to go down the left-hand column and get a Medicare Supplement, or go down the right-hand column and get a Medicare Advantage plan. And sometimes people use those terms interchangeably, but they're very different products. So be careful when you're talking to somebody about whether you're talking about a Medicare Advantage plan, which is managed care, an HMO or a PPO, or a Medicare Supplement plan that supplements original Medicare, and it would be considered traditional insurance. So we're going to be talking about all your options coming up here. The government has Medicare Part A and Part B, and I'll cover that in detail in just a second. And in addition to that, if you stay in option 1 on the left-hand column in that original graphic, you would also buy a prescription drug plan and a Medigap or Medicare Supplement policy. They mean the same thing. Medicare never covered prescription drugs until the year 2006. And so that is, in our world, a recent development. If you choose option 2, it's called Medicare Advantage Part C, okay? Medicare Advantage Part C, as I mentioned earlier, are typically come in 2 flavors, an HMO or a PPO. There's some other products that I crossed out because you may see a reference to them on the internet, but they're not really sold in our marketplace. Most of the Medicare Advantage plans include a prescription drug benefit. There's a couple that exclude, do not cover prescription drugs, and those are typically marketed to veterans because they can get their prescription drug benefit through the Veterans Administration. So you don't buy a Medigap policy if you have the Medicare Advantage, you don't double up. And in Washington State, last statistic I have, about 1/3 of the Medicare eligible individuals in the state are on a Medicare Advantage plan. It's closer to 40% in King County, where we're located. Your benefits under Part A for the hospital, the big idea here, I'm not going to read everything, is that the first 60 days you're in the hospital, you pay in the year 2020 $1,408. They call it a deductible. That's not the term we're used to today. We would call that a co-payment because you're going to pay it every time you go in the hospital during the year. The government calls it per benefit period. So the point is, this is not an annual deductible. This is an each time you walk in the door to the hospital and you stay overnight, you're going to pay $1,408 each time. So if you're in the hospital 3 times during the year, you're going to be paying $1,408 3 times. Part B is titled Medical, and it includes your doctor visits, your surgery, your physical therapy, your durable medical equipment, diagnostic radiology, labs, preventative care. Part B, drugs, which are typically something administered in the doctor's office, an infusion, often chemotherapy. The cost to you for Part B is $198 calendar year annual deductible in 2020, plus 20%. The important thing on this slide is this 20% on Part B has no out-of-pocket limit like your group or individual health insurance plan. So because you may have to pay multiple deductibles in the hospital and with no limit, and you may have to pay 20% with no limit, most people buy additional insurance. And we'll cover that in a few slides going forward. Medicare Part D, D as in drug, prescription drug benefits, either it's a separate plan in the column 1 on the left-hand side, or it's included in Part C. You don't buy a separate drug plan if you're in a Medicare Advantage plan under most circumstances. It's confusing. And we'll cover this in more detail, but you may have 4 different prices for your drugs. The first part is the deductible, where you pay the full retail price of the drug till you meet your annual deductible. Then during the initial coverage, you're going to be paying at least you're going to pay 25% or a co-payment, which could be a fixed dollar amount. Could be 0 for a generic, could be $5 for a generic, could be $35 to $55 for brand name, and could be $100 or more for non-preferred brand name prescriptions. And at a certain point, you go into the coverage gap where you actually pay a mathematical 25%. And again, as you reach the threshold for catastrophic coverage, your price goes down to 5%. It's confusing, and this is where I spend a lot of time counseling people on what their plans are. I have a computer program that we can look at all the carriers in the area and see what your costs are at whatever pharmacy you pick, and I share that on computer screen sharing meetings with you. How much does it cost to get into Medicare? Most people are going to pay 0 for Part A because you've been paying a premium tax your entire working career. So as long as you have 40 quarters or 10 years of paying Medicare payroll taxes, whether you're employed or self-employed, That means you've paid your Part A. So when you get to age 65, you don't have to pay anything for it. Part B is based on your income. But most people, 80% of the population, pays just $144.60 a month for Medicare Part B. Your cost could be higher. The highest premium is about $500. Here's an example of the Part B premium for 7 years, just the history. Back in 2014, the cost was $105, and it was $105 the next year in 2015. Then it went up quite a bit, a big jump. Then it leveled out at 134, 134, 136. As you can see, Medicare Part B premiums are fairly stable, no significant adjustments. And if there is, they kind of flatten out for a little bit. We do not know the 2021 premium for Part B yet. We do not know the deductible for Part A or Part B for next year. That usually comes out around Thanksgiving. Okay. Here's an example of what the cost is as your income goes up. So if you take a look at the Part B premium, if you're an individual earning $87,000 or less, or if you file joint, a couple earning $174,000 or less, you pay the base rate of $144.60 and no additional cost added to your Part D benefit. It's the final column. If you're just $1 above that threshold, you're going to pay about $50 more for Part B, plus you're going to be paying $12.20 to the federal government for your Part D benefit, and so on. And as you earn more income, the cost goes up there. However, if you retire and all of a sudden you've got a drop in income, you can fill out a form and send it to the government, and you can notify them that you're no longer earning your high income and it's adjusted to a different figure, and your costs can go down. But if you don't fill it out, it eventually will show up in your premium 2 years in the future. But if you want to get a reduction, do it as soon as you sign up for Part B. And after you get your Part B card, you have to wait till you're actually officially in there. You don't do it at the time of your application. But you can call me up and we can talk about that. So here's a quick summary. What does it cost for Choice 1, which is original Medicare, a Part D drug plan, and a Medicare Supplement or Medigap plan? So again, Part A is $0, Part B rounded up $145 based on a base rate, not a high income rate. Part D plan, about $25, a Medigap plan, $190, $200. So that's going to be $360 a month. And for many people, this is better than their group plan. There's only $198 deductible on Plan G that we'll show you in the second half of the presentation. If instead you go to a Medicare Advantage plan, you again will pay $0 for Part A and $145 for Part B. And Medicare Part C, you can get starting at $0 additional premium, but you still always have to pay the government for Part A if there's a premium, and Part B. So you can get your option for Medicare Part C, Choice 2, starts at $145. And this is where we have a discussion on, does it cost less to go on Medicare or stay on your group plan? Hang on, we'll cover that just a little bit. Who's eligible for Medicare? As long as you, again, paid payroll taxes for 10 years, you're eligible. And it's whether you or your spouse paid. So you may be a non-working spouse and a full-time volunteer or taking care of parents or whatever a spouse does, that you can get eligibility for Medicare and Social Security based on your spouse's work record, not your own. Okay. Most people are eligible at age 65, but you can be eligible before that if you have end-stage renal disease, which is kidney failure. You're on a dialysis. Lou Gehrig's disease, also known as ALS. You can start benefits quite rapidly if you have those two diseases. Or if you're disabled, you've got on a Social Security disability benefit from the government, just not private insurance. You have to qualify for Social Security disability. You will be given or mailed a Medicare card after you've been on a Social Security disability payment for 24 months. You have to pay the Part B premium when it comes, but you'll be eligible after 2 years. So let's talk about employers. A lot of people continue to work past age 65. TEFRA stands for the Tax Equity and Fiscal Responsibility Act, a budget bill, was enacted in 1982, and that coordinated Medicare and employer-provided benefits. So basically, the employer plan will pay first, the Medicare plan will pay second, and if you bought a Medigap policy, it would pay in third place, but by that time, everything's paid. If it's groups under 20 employees, the rules are slightly different. So, and since the government brought in another regulation called the Medicare Secondary Payer Provision, and if you've got 20 or more employees, you cannot discriminate against somebody older. You cannot move them off the plan. You cannot give them a financial incentive to quit. So basically, groups with 20 or more employees, people are on their benefit plan at any age. I have some clients who don't retire until they're 73 or 74. I recently had a client retire and go on Medicare for the first time at age 82. So how do you enroll? Medicare is administered by CMS, but you enroll through Social Security for most people. Or if you have been working for the railroad, you go through the Railroad Retirement Board. Enrollment in Part B is your choice. Now we're going to talk about when you can enroll. First of all, we talked about the benefits. We talked about the cost. We talked about if you're on a group plan and you have more than 20 employees, your employer has to continue to provide that benefit to you. But when can you enroll? If you don't have group insurance, or if you're already retired, or if you're self-employed like myself, your initial enrollment period, the IEP, is a 7-month period beginning 3 months before you turn 65, the month you turn 65, and 3 months following the month you turn 65. This happens once in your life, around your 65th birthday, it's obvious. Okay. If you are getting a Social Security check, you will automatically be enrolled in Medicare. You can keep Medicare A and B, but you're going to have to start paying for Part B, and it comes out of your Social Security check. But if you're covered by a spouse's plan, or if you're continuing to work, and there's no reason to pay for that if you've got group insurance that's a reasonable price, you can always tell the government you don't want Part B. You can come back and get it later when you actually retire or are no longer eligible for group benefits. And on the right-hand side is the new Medicare card. And the left-hand side, the Medicare claim number was your Social Security number until 2 years ago, approximately. And so now it's just a random number, 11 letters or digits, and there's no rhyme or reason to how it comes out. So if you miss the general initial election period, you can sign up for the general enrollment period, and that's the first quarter of each year, but coverage doesn't start until July 1st, and there's a 10% penalty for each year you wait. And so this is very rare, but I've seen it probably a half dozen times in the last 10 years. This is somebody who just hasn't been paying attention, hasn't been asking questions. They leave the group plan and they don't think they need Medicare because they're healthy, or they just forgot because they got busy with a family member or something else. If you don't sign up when you leave your group plan immediately, or it's more than 3 months past your 65th birthday, you have to wait till general enrollment period. And that's not pleasant because I can't find individual coverage for you in the market, you'd be uninsured until this starts. Unless you go back to work and get benefits through an employer. This is probably one of the most important slides of the presentation. This is where most people sign up for Medicare if they continue to work past age 65, or if they're a spouse and they're over age 65 and the employer says, oh, all of a sudden we're going to start charging more for the spouse. And you say, well, I could sign up for Medicare, should I? And this is your option to sign up for Medicare during the special enrollment period. So anybody who's actively employed or their spouse is covered by a group plan, you can sign up anytime you're currently employed or within 8 months of the end of employment benefits. So if you retire and you lose group insurance, you can sign up for Medicare anytime in the next 8 months and you won't have a late enrollment penalty. If you go past 8 months, you got to go to the general election period to sign up. So most people I talk to are working to 67 so they can get their full Social Security retirement benefits, or they're working, a long time. They just enjoy what they're doing. So retirement isn't on their radar until a later time in their 70s or 80s. Again, there's no late enrollment penalty, no increase in premium. There's other special enrollment periods that apply to people who have got to change their residence or their Medicare plan terminated. But the SEP that we're talking about here is really designed for somebody leaving a group plan. And finally, on the government slides, I'm talking about all government benefits now. We'll cover marketplace options in the next section. If you're low income or you've got a parent or a family member with low income, you should look into extra help. And this is a government benefit called extra help for prescription drug costs. And you're eligible for it if your income is less than the numbers on that page or the resources as shown. And the resources include your cash, your investments, but not one car in your home. Okay. What do you get for this? You can get help for paying for your Part D's prescriptions, including a reduction in the premium, the deductibles, the co-pays, and co-insurance. There's 4 different levels of benefits here. There's no coverage gap that we'll cover in the second half. No late enrollment penalty. If you had one, it's forgiven and it goes away. It's a great deal and can save family members or you some costs when your income is low. Okay, I'm going to take a quick sip of coffee. You'll notice the colors of the slides change because the first half of this presentation, I covered government benefits, Medicare, the rules, the benefits, the cost, the eligibility, and the enrollment process. Now I'm going to talk about the marketplace options. What can you buy in addition to a Medicare? And again, this is a different way of looking at option 1 on the left-hand column. You have original Medicare, Part A and Part B that we covered. Now we're going to talk about prescription drug benefits and Medicare Supplement plans and wrap up with option 2, Medicare Advantage plans. It's important to know that enrollment is critical. You need to know the rules, the timing, what guarantees are out there. And if you miss an enrollment period, it may not help you, and it may be a painful cost if you can't get the insurance that you want. So everybody should at least start thinking of their Medicare options, at least a year before they turn 65 and see if it makes sense for them. I get calls all the time, explain to them what the rules are, and they go, well, I'm not going to retire at 65, but I heard you had to sign up for Medicare. You don't. It's a choice. And as you see, there's a cost for that choice. So people who are covered by a group plan where the employer is paying the substantial portion of the cost, typically for employee, it makes sense to stay in the group plan. But if the spouse is paying the full premium, $600 or $700 a month for the group plan, Medicare and these choices I'll cover might be a lower cost option. Everybody's different. There's no right answer for everybody because a lot of it deals with the cost of your prescriptions. When do you need to sign up for Medicare Part D? You must sign up within 63 days of being eligible for Medicare. That's right. You've got to sign up within 63 days of turning age 65 because that's when you're first eligible for Medicare. But you don't have to sign up if you have creditable coverage from your employer. And most employer plans are creditable. What that means is it's as good as Medicare. So if you've got a prescription drug benefit through an employer that's as good as Medicare, you can stay on that, and they are required to give you a notice once a year. I put a caution on here is some high deductible or health savings account plans may not be creditable. So look at that notice and see if your drug benefits are as good as Medicare. If they're not, you can sign up for Part A at no cost and then sign up for Part D, and plans start at about $6 or $7 for a prescription drug plan. So it won't cost you too much to do that. If you don't sign up when you're first eligible, which for most people is, if they're self-employed or retired at age 65, or for the rest of the population when they leave their group insurance plan for the first time after age 65, there's a late enrollment penalty of 1% per month if you don't sign up. So if you don't sign up for 3 years because you thought, well, I don't really need anything, I'm not taking any drugs, so why do I need insurance? You'd pay a penalty of approximately $11 a month every month for the rest of your life. So there's no reason to pay a penalty if you can get a drug plan for under $10, and then it's at least it's going to cover you if something happens. So I'm not going to cover all the details here. We covered this in an earlier slide where I told you there's 4 costs, but for 2020, here's a way of looking at it is if you have to meet a deductible, it can be as high as $435. Many plans today, the deductible only applies to brand name or expensive drugs. It's typically waived for generic drugs. During the initial coverage, you may have a co-payment, like I said, $0 to $5 for generic and $40 to $50 for brand name. And on the left-hand side, it shows us what happens as the cost increase and that's the threshold. So if your total drug cost, what you pay at the pharmacy and what the insurance company pays the pharmacist or the pharmacy, the total costs are added up. And if your total costs year to date exceed $4,020, you go to the coverage gap. And in the coverage gap, you pay a mathematical 25%. And then we flip over to the out-of-pocket column on the right-hand side. And if your out-of-pocket costs plus manufacturer's discount exceeds $6,350, then you move into catastrophic and you pay 5%. What's not showing on this slide is there's no out-of-pocket costs for prescription drugs. So that can be a dilemma for people who've got expensive drugs and they're only paying $45 or $50 on their group plan. It could get a lot more expensive on Medicare. Often people will find that the Medicare benefits for doctor and hospitals are better than the group plan, but people who've got expensive drugs, Medicare's not as good. Okay. And yeah, the government may change this in the future, but don't hold your breath on that. Oh, let me just go back one step, is starting in the year 2021, is some of the plans, and I've got 4 of the Medicare Advantage plans that I work with. I work with 8, 4 national and 4 local, and half of them have a special benefit called senior drug benefit. And what that does is it limits the cost of brand name insulin in their formulary. They don't cover every insulin, but the brand name insulin that's in their formulary, your copayment is $35 a month in all these categories. And so that's going to really save people a lot of money who have insulin. Okay, so here's an example of 3 different plans. The premiums on the bottom, a low-cost plan, there's some costs there. And as you go up to a little bit better plan, your co-payments may go down, your deductible may be waived. I'm going to update the slide for next year, but you know, I think I've got 20 different prescription drug plans available, and this is standalone Part D. Okay. If you have a Medicare Advantage plan, you get the drug plan that comes with it. You can't pick and choose like you can if you are in option 1 on the left-hand side of that picture, where you can buy a Medicare Supplement plan, you can change your drug plan every year. And people say this is confusing. I go, it's really just an accounting problem. But it's not what you've been used to for 40 or 50 years from your group plan. So it's just kind of re-educating and looking at what your options are under the Medicare Part D benefits. Medigap policy also is a Medicare supplement, means the same thing. The important thing is that when you first sign up for Medicare Part B, no matter what your age is, if it's at 65 or 75 or 85, when you first start Part B with the federal government, you can sign up for any Medicare supplement plan in the market, guaranteed issue, as long as you sign up in the first 6 months after Part B starts. There's no late enrollment penalty. You cannot be denied. And Washington State goes one step further, not other states, but Washington State, if you have a Medicare supplement, you can change to anyone else's or any plan with the same carrier Medicare supplement plan any month of the year, guaranteed issue. So if one company raises the rate, you can move to a different company. So that's pretty good. All the Medicare supplement plans are standardized. There's a letter. So Medicare has Part A and Part B and Part C. And Medicare supplement plans have Plan A and Plan B and Plan C. So not to get confused there. And the fourth bullet there, they're all standardized. So if you get Plan F from the ABC company, it's the same as the XYZ company. It's the same as the green company, the blue company, the orange company. Plan F is Plan F. They're universal. They're standardized. Cost is the only difference. They may throw in a fitness club benefit, but it seems like everyone's doing that now. So Plan F, as you can see on the first line, it pays any costs in the hospital. It pays the Part B costs in full. You go down a little bit, it pays the Part A deductible in the hospital in full. It pays the Part B deductible in full. And it pays any Part B excess charges. Only F and G cover Part B excess charges. And what that is if the doctor charges more than the Medicare allowed amount, this plan will cover it, F or G. If you have any other Medicare supplement plan, you pay the difference out of pocket. So that's why I only recommend Plan F or Plan G. You cannot get Plan C or Plan F if you were eligible for Medicare for the first time in 2020 or later. So for most people born 1955 or later, you're not eligible to get C or F. Your older spouse or family member can, and they can keep it. But I was born in 1955, so I missed the ability to get Plan F by 6 months. That's okay. So Plan G is the most comprehensive plan on the market right now for newly eligible Medicare enrollees. The only difference is you pay the Part B deductible. So here's the first quiz of the day. Okay, well, not really, but do you remember what the Part B deductible was? $198, you're correct, okay. $198, that's your only risk for Plan G. So in other words, if you have Plan G, after you pay $198 for basically your first doctor visit, you know, or lab or whatever it is, everything's paid at 100%. Your hospital's 100%, your doctor's 100%, your durable medical equipment's 100%. It's a great plan. It might be a little pricey for some people, but it's the most comprehensive plan in the market. That's about $200 a month. Okay. Plan F, if you can still get it, is about $225 a month. So you're going to save money by going to Plan G, no matter what your age is. But some people still like Plan F if they can get it, because they like the concept of, I don't have any paperwork to deal with, everything's paid in full, I'm done. Now, supplements don't cover drug benefits. Remember, I just covered the drug benefits separately, and this is a separate price. So these supplement benefits do not include prescription drugs. A Medicare Advantage, and we're getting near the end here, a Medicare Advantage is also called Part C. And if you have a Medicare Advantage, you pay the government the premium for Part B, but now the insurance company that you select gets money from the government to pay the bills to the doctor, and the doctor bills the Medicare Advantage insurance company you are enrolled with. The doctor does not bill Medicare because you sign up with a Medicare Advantage plan. So they were modernized back in 2003 when the prescription drug benefit was passed by law. And they used to be called a Medicare Choice Plan. And but they added the prescription drug benefit. So that made the big difference way back then. And they came into the market in 2006. So heavily advertised because the insurance company wants to get as many people into their plan as possible to spread the risk. How can they offer it for zero premium, starting at zero premium? It's because the government's going to pay $500, $600, $700 to every month to that insurance company if you enroll. And that's how they can get the funds to pay for the bills, because they don't know who in the pool is going to get sick this year, who's going to go in the hospital, who's going to have chemotherapy, who's going to break their arm, etc. And so they take on the risk, and the government washes their hands and say, there's your money, take care of them. And the Medicare Advantage carrier must cover everything in Medicare Part A and Part B. There's no missing benefit. The difference is they changed the co-payment or co-insurance, what you pay for it. So, couple acronyms. The Medicare MAPD stands for Medicare Advantage with Prescription Drug Plan. MA is the Medicare Advantage plan only, bare, no prescription benefits. The only people should even think about that are veterans. A prescription drug plan is also under Medicare Advantage, but there's no medical, but it's typically known as Part D in the marketplace. And you combine that again with your Medicare Supplement. You with me? Remember, I said there's a maze out there. There's a lot of moving parts. And if it's confusing, it's because you're seeing it for the first time. It's not that hard if you're willing to study it and learn it. But that's how I can help you and guide you through all these things. Medicare Advantage with prescription drug and Medicare Advantage plans without prescription drug fall into a couple categories: an HMO, a PPO, and a special needs plans for people who are on Medicaid and Medicare both. Typically, under an HMO, you name a primary care doctor on your application, and typically that primary care doctor needs to refer you to a specialist. Not always, but that's typical. You need to stay in the network except for emergency on the HMO. So I just call that the economy. That's the base model. A PPO plan, on the other hand, is similar to the HMO, but it adds an out-of-network benefit. So that gives you peace of mind. And if you can't find a doctor in the network, you can get somebody to see you, and it's covered about 50-50 from the insurance company. In our area, the networks are extensive for the HMOs, so just about every major clinic and hospital is in most of the plans. Again, most, not 100%. Okay. How do you sign up for Medicare Advantage? The enrollment is the initial enrollment period, same as original Medicare, right at your 65th birthday. General enrollment period, same as original Medicare, fourth quarter, coverage starts July 1st. Special election period for most people working past age 65 when they leave their group plan, or a spouse can leave anytime. And once a year, there's the annual enrollment period, election period, which is heavily advertised starting today, October 15th. all the way through December 7th. So once a year, if you're in a Medicare Advantage plan, a Medicare Advantage plan with or without prescription drugs, or just a separate prescription drug plan, you can change your plan in that 7-week period at the end of the year, but benefit changes start January 1st. There's no annual enrollment period, again, for Medigap or Medicare Supplement plans. You can change any month you want in Washington State. Here's an example of what you may see in a Medicare Advantage handout. And it will say, what does it cost for your deductible? Most plans have no deductible. Most plans today have no cost to see a primary care doctor because there's so much competition out here. To see a specialist, about $50. The big difference is the hospital. How much do you pay each day in the hospital and for how many days? Prescription costs, I've got numbers there, $3 for tier 1 generic, $12 for tier 2 generic, $47 for tier 3 preferred brand name, $100 for tier 4 non-preferred brand name, and 28% for specialty drugs, 28%. All plans have an out-of-pocket maximum, but that out-of-pocket maximum applies to Medicare Part A and Part B benefits only. It does not include a prescription drug cost in the out-of-pocket maximum. And Medicare Advantage is an advantage over Medicare because they throw in something that Medicare doesn't cover, like a health club, HC, a vision benefit, a hearing benefit, or a dental benefit. Don't be deceived. It's not a dental benefit like you have at work. It's typically a preventative care benefit, which would be cleaning and exams and x-rays, and that's it. At the most basic level, if they cover it, it could be a flat dollar amount, like $300 or $400 a year. But it's typically not comprehensive dental with $1,000 or $2,000 annual benefit. But that's changing, so you have to look at the details. Every Medicare Advantage plan is not standardized like a Medicare Supplement. Supplements are standardized. Advantage plans are not. So you'll see all these little different copays. They're all getting a little bit confusing because they're so similar to each other, but they're not the same. The big difference in making a decision typically comes down to what's the cost for prescription drugs at the end of the day. So quickly, in summary, you need to enroll in A and B before you can sign up for a supplement or an Advantage plan. And no matter what choice you make, you have to pay the Part B premium to be eligible for anything else. I call option 1 the luxury level because you get 100% coverage after a $200 deductible on Plan G. And option 2, I call it the economy model because it costs you $0. And it doesn't matter which plan you buy. They all cover the same thing. They're all going to get you what you need, except you're going to have more out-of-pocket costs on the economy model than the luxury model. And the luxury model has no network. Go anywhere you want, anytime you want. The economy model of HMO, you may need to get a referral to a specialist. They're managed care plans, and your doctor typically needs permission to put you in the hospital for surgery or for expensive diagnostic services or chemotherapy, things like that. So they need to get pre-authorization from the insurance company on your behalf. Enrollment in Medicare, again, is automatic if you are retiring before 65 and receiving a Social Security or Railroad Retirement Benefit retirement check, or if you've been on Social Security disability payments for 24 months. If you're not taking Social Security and you're not covered by an employer plan, as in other words, you're retired or self-employed, you should sign up during the initial enrollment period, which is 3 months before, the month of, and the month after you turn 65. There's a special enrollment period that affects most people working past age 65 or their spouse. Sign up within 8 months of leaving the group plan. The reality is very few people wait 8 months. They sign up the next month, so there's no gap in coverage. Or if they go in COBRA because they've already met their out-of-pocket maximum or their deductible, don't stay on COBRA for more than 8 months. That's the simple answer. And if you missed all the above, you've got the general enrollment period to fall back on for first quarter of every year, but coverage doesn't start until July 1. So you could have a long wait without insurance if you miss it by 1 day. When do you sign up for Medicare Part D? Within 63 days after leaving creditable group coverage, which is 63 days after you leave your group plan, or within 63 days of turning 65 if you're retired or self-employed. Your Medicare, Medigap, Medicare Supplement plan, sign up within 6 months so you can get the guaranteed issue. Medicare Advantage plan, same dates to sign up for original Medicare for the first time. And once you're on Medicare, everybody can make changes during the annual enrollment period, which is change your Medicare Advantage plan or your Part D prescription drug plan if you have a supplement. The annual enrollment period is October 15th to December 7th. And last year, for the first time, they added a Medicare Advantage open enrollment period. Oh, wait a minute, you just told me that. Technically, they call it the annual enrollment or election period in the fourth quarter, and a separate Medicare Advantage open enrollment period in the first quarter. But that's only for people already enrolled in a Medicare Advantage plan. They can change to a different Medicare Advantage plan if they found out something's not working right. The network's not right. Why do I need to get a referral? If they misunderstood what they did, they've got the first 3 months to make a correction. They can go back to original Medicare and add a Part D plan, but you're not allowed to change your Part D plans during that period, but you can change your Medicare Advantage plans or go back to original Medicare. And as we wrap up here, health savings accounts, if you have a health savings account, you can contribute money to it at any age. However, your contributions must end when you're enrolled in Medicare. At age 70 is the maximum age for deferring Social Security and getting a deferred credit. So why would anyone wait to take their Social Security after age 70? They won't. So 70 is the first start for people taking, or the last date for somebody starting Social Security for the first time if they deferred it, except Social Security always includes Medicare Part A. So as soon as, when you ever start Social Security, Part A comes with it and you can't stop it. So the reality here is if you're still working and you're deferring Social Security, you can continue to make health savings accounts deposits, but don't sign up for Part A. At age 70, you're going to get Part A with your Social Security check. So that's really the end of your deposits for your health savings account. If you don't know what I'm talking about, you probably don't have a health savings account at work. So it's a unique feature, a tax shelter to put money in and pay your Medicare premiums or your out-of-pocket costs for medical, dental, and vision. If you go on COBRA after you leave your employer, don't be on it for more than 8 months if you're over 65. And if you retire, go on Medicare, then go back to work, you can call Social Security and request your Part B coverage is stopped. And they'll tell you how to get it started up again. There's a couple forms you need. Okay. So as I wrap up here, just remember I can help you or any family members or friends with your health insurance solutions, no matter what your age is, whether you're eligible for Medicare or individual insurance coverage. I can be an advisor for you at no cost. I'm right here in between Auburn, Kent, and Black Diamond in King County. Thank you for your time and I wish you have a good day.
Thank you so much, Jess, for the presentation. Hopefully we'll be able to provide this to anyone in need. If you have any questions for Jeff, his contact information is here. If for some reason you do want the actual recording or would like a copy, as I mentioned, I'll be happy to email that to you, or you can follow our YouTube channel, kitchamber.com, and it'll be uploaded there as well. Again, if anyone would like to reach out to Jeff, his contact information is below, 253-249-7846, or if you need to reach the chamber to do that, our phone number is 253-854-1770. Again, we do appreciate you, Jeff, and we will go ahead and conclude the day. Have a great day.